Basically, men do not respond well to facelifts because they become a feminizing effect. Because when they pull them, they become done, and it's not a good look. I'm sure you've seen actors and various people who've had facelifts who are male. It's very, very difficult to get a good facelift for a man. So basically what we see here is that most of the volume loss he has is again in the lower third because he's a dental grinder. You see this big depression down here under his lip. And also what you see is the labiomandibular grooves that are partially hidden by his beard. Men can always grow beards. And then you see the nasolabial fold. So what we want to do is restore the end of his lips, which at the present time are inside his mouth. And we want to restore this dent in the lower third of his face, bring up the corner of his mouth, and do the nasolabial folds up here. And by doing that, we should be able to give him a much more rested look. And the key thing is not to make people look different as though they're an FBI relocation program, but you again want to make them look better. You want to make people look good and rested, okay? So we've used a strong agent on him, the eutectic, which is made by the Tampa Pharmaceutical Company, who also is the people who patented beta-K in LA. And here we're going to use the Juvederm 30, and that's more viscous. Open your mouth for 1 second. We want to do the end of his lips to re-support his mouth. So bear with me for 1 second. We drop into the lip, and we restore the end of his lips right there. You see that restoration right here? You see that flow along the potential space of his lips right there. Okay, now I'm going to move the needle as we went in, and now we're going to lift up the corners of his mouth. And what we're going to do to lift up the corners of the mouth, open up your mouth just a bit, is again lift up the corner with our trick injection inside the mouth, because we lift up the corner from inside the mouth. We go into the potential space on the mucosal side of the potential space. And we move the needle very easily. Now close your mouth. As you can see, his mouth goes horizontally now. Now what we want to do is build our flying buttress up in the corner of the side of the mouth. And what we do is we pull firmly against his face right here. And we build a little bit of a flying buttress with serial puncture. And I believe it's a little more lateral, you see, because I need this. Now, can I have some dry gauze to dry that out? But if you pull off the beard, you'll see that the beard, what it's covering is this depression that's medial to the beard right here. So the depression we see is right there. So what we want to do is pull this down right here and lift this up right over here. You see the serial puncture. And we flow the material up the corner of the mouth. In doing so, what we do is elevate the corner of the mouth. Now, when I was originally trying to figure out where the lips belonged in the face, it was only after I read the dental literature that I realized that it happens as we age, is our lips go south because we lose dental support. And what we want to do is keep our lips up high, because the lips go further away from the nose. And what they do is they go further away, and the lower lip gets closer to the chin. Now, we want to build more of an anterior flying buttress also there. So we're going to go now more anterior, just like that, and build another little bit of the buttress there. So what we're doing is building a buttress that's going to hold up the lower third of the face. We pull that out. We just made it flow all into the space. Now, take a look at that. Let me just take a look over here, and let's turn it, and that looks perfect. Now we see this denting right down here. So what we want to do is bring his lip out a little more yet. Open your mouth. So we want to bring his lip out a little more laterally. So we just put a little shot, a little laterally going into the lip, just like that. And that will bring the lip out more laterally than we even were before. There we go. And how much does that hurt? Okay. So you have to go slowly, and you have firm pressure against what you inject. Now what we want to do now is the dent in the lower third of the face. So again, we stretch it. We use serial puncture, and we flow the material right along here. And we flow it, and it's a little more difficult because, again, this is more viscous, so we're using a 30-gauge needle. That gets rid of the dent there. And then what we want to do is get rid of a little bit of the dent over here. So again, we stretch this very, very tightly so it doesn't hurt. And we use a serial puncture. We press in the needle and let the material flow under the skin. In doing so, we raise up the skin, this dent, this depression in the lower third of his face. Okay. Now, that did very, very well. And then we want to go up. Now, what's key thing is not to start injecting down here. You'll get too much bulk. So you only want to inject way up here. You want to inject slightly anterior to the nasolabial fold. So hold on one second. Bear with me. We do very, very slow injections. And using firm pressure to inject against. Hold on one second. And 1 second. And here we do. We see the material flowing under the skin and stretching the skin firmly. Hold on. And what we're going to do is go a little bit up by his nose. So we go a little bit more there. So we're going to go up here. Years ago, plastic surgeons always liked to preserve this angle around the nose. And then when I started using fillers, even back in '79, I always started getting rid of it because I noticed in younger people they didn't exist, these shadows around the nose. I see a little bit still this dent here. You see that? Yeah. So let's put a little layer more, a little bit more right here, and that'll be it. Again, we're re-injecting the area, and we're again using serial puncture technique to watch material come up to the surface. Hold on. You want to wipe that off? So we have the corner of his mouth up. We see the dent of his lower third of his face is much better, and we see the end of his lips have been restored. Okay? You feel any bumps inside your mouth whatsoever?
No.
Okay. Let's go look at the other side now for a second, and we'll begin on that other side. Now that we look at this now, you can see the left corner of his mouth goes up. That's because we restored the end of the lips that have gone inside of his mouth as he underwent the aging process. And if we built this flying buttress up that supports it, so it's lifted up those ends of the lips. So we're actually inside his mouth when I brought them up. So there's greater volume in the lower third of his face. Additionally, we've got rid of the dent in his chin. And also, if you look at that side of his face, you can see that the fold from the corner of the angle of the nose to the mouth has gone essentially away. You want to point out where it's gone away, where you can see it? Where it's disappeared totally on that side of his face, his nasolabial fold. So we flatten that out entirely. As you can see, still see a fold on the other side. So we're going to bring out the lip, build our flying buttress so both the corners of the mouth go up, and also we're going to rebuild the nasolabial fold on the alternative side with the same product. So here we go, Juvederm, using Juvederm 30, which is a more robust form, on this side of the face. Okay. What we want to do now is restore the ends of the lips right here. So what we're going to do is open your mouth just for a second, is gently drop the end of the needle on the mucosal side of the potential space, and just gently flow this into the lower lip. And you can see how it gently flows just like that. Okay. Now what we want to do is we want to go up and lift up the corner of the mouth. Now how much did that hurt, Bruce?
Not at all.
Okay, now what we do is open your mouth, and we go right here, the potential space inside the mouth, again holding it down, and gently injecting up and lifting up the space of his mouth. So basically what you're doing is restoring the height of the mouth. So that goes right up here. As you can see, it goes around the corner. Now let's have you close your mouth right over there, okay? So I would put a little more right out here. You see that? Just like we did before, putting a little more in the lower lip. Making sure we extend out the lower lip as well as lift up the lower third by connecting the space that was non-existent between the lower and upper lip. So as we go there, want to wipe that off. Just a whisper. So what we want to do is go into the space we went in, but going a little more into the upper lip. So we go from here, so we fill the space and we drop it into the potential space. We go along a little bit because we're restoring the ends of the lips. And this will be imperceptible to anyone, but they'll see that their lips go up. Now you can see now what's happened is the corners of the mouth go up. Okay, now what we want to do is restore this dent of the lower third of his face. So what we do is we put pressure and pull this off just like this, and we fill this in a serial puncture technique. We flow this material, see how it gently flows very easily underneath the skin, and it fills in that space, lower third base. You want a little bit right more there. We drop the needle in more or less at a 45-degree angle, but you want to make sure that it doesn't get too superficial or lumpy. Now, a lot of people use a retrograde injection, as they inject as they pull out the needle, as they would with fat, but I've never found that very effective in using fillers. Now, what we want to do now is build a little bit of this flying buttress over here. So we want to put a little bit over here. And we want to do it not from all the way down here, but we're going to build a flying buttress from right over here. And that will give them, again, the support. And let me see this right over here. And we really don't have to come all the way down this. Now, what you have to know is when you bring out the lips in that manner, it will flatten the nasolabial fold. But you still have to add a drop over here, anterior, slightly anterior to the fold, though I sometimes inject on top of the fold to flatten it out. Again, the key thing is to do this slowly and have a firm, surface to inject against, because what you don't want to do is you don't want to skewer the patient. Now let me take a look. We may put a little more on that side. Let's take a look at this. Okay, this was using a 27 needle. So you can use a 27 with it, which comes with it, and also use a 30 if you want to go to finer places with this. And so we're going to go slightly lateral up here. Fill in the space. Again, doing this very, very slowly. Okay, and that doesn't hurt any more than the 30 when you go slowly. And the only thing I see is this one little dent under the lip right here, which you can see. And we'll do that just a wee stroke, get rid of that dent. What we're going to do is flatten that out by even going above it. And you'll see this hurt a little bit because we're going to go very close to the nose, which is a very sensitive area, and we're going to go right up here. See that? And what we're doing is flattening the space, okay, right around his nose. Bear with me. And by doing that, you also, by doing that, pull up the corner of the mouth. So how do the corners of the mouth on this side look now? Let's take a look. Take a look right from here. It looks perfect. When he smiles, you see his upper teeth. Now just relax. You see that both corners of the mouth go up now. That we've restored the lower third of his face. He doesn't have a dent under his lips. And we soften the nasolabial folds. So he looks rested. He looks better. But good that he doesn't look done. The face of a man, unfortunately, you can always tell the difference.